It's with great pleasure that I introduce Brattleboro Rotary Club to Dr. Chelkh Thiam and Dr. Chelkh Thiam to Brattleboro Rotary Club. Chelkh is one of my two primary academic leaders at School for International Training. He is the academic dean in the Office of the Dean of Faculty, which is the office that oversees all the academic affairs of SIT. Chelkh, if I may say so, he's been with us for a few years now. He came to us from the Ohio State University, where he was a tenured associate professor in Africana Studies. He's been a leading voice in Africana Studies in the United States. To Ohio State's loss and our gain, he wanted to move back to Senegal from where he comes. And so we were really delighted to be able to snag him for SIT. And the great thing about SIT, as you all know, is that we do our business globally, and we can have our leaders and our faculty wherever we work. And so Chelkh has been able to join our leadership from Senegal, and so co-runs with me and my senior team the School for International Training from his base now in Senegal. Chelkh is also a leading philosopher, particularly in the field of negritude. And as you can imagine, he's really been at the forefront of being able to support us through our own conversations around diversity, equity, and inclusivity. He's also provided leadership in our conversations from the Global South. And he always challenges us to think otherwise and to think from different places in the world than the one that we presently sit in Vermont. So in that regard, I thought it would be wonderful, and thankfully Chelkh agreed, to hear a little bit about the experience of undergoing this pandemic from another place, and a place that frankly has been doing rather well, and has completely reshaped the way that we think about the ability of countries to manage issues such as pandemics. And so we agreed on this topic, and I'm so glad that you're willing to do it, Chelkh. But he did, I think maybe he also had a slight alternative motive, because he did let slip to me about an hour ago that he actually has a history with the Rotary Club. So I hope you're going to mention a little bit more about that, Chelkh. So he's just really delighted that to be back with you all. So anyway, I'm going to get out of the way, and thanks so much, Chelkh, for coming along and sharing with us today. Over to you.
Thank you, Sophie, for this very generous welcome. Thank you for your leadership. Sophie did mention that I am the academic dean, part of the leadership of SIT based in Dakar. I think that that tells a lot about you and the executive leadership of SIT to engage in creating a true organization where people like me, based of the world, the place that people pay little attention to generally, to give us this voice and spaces of leadership in an organization that's like this. And this will be a segue to my talk today. I'm going to be short. It's this type of engagement that we would want as Africans when we talk to the world. Engagements in which we are not necessarily just presented as children to be helped, but as equal human beings as we engage in our common humanities. Thank you also, Marty, for corresponding with me and creating this space. And Sophie is right. I was delighted to be invited here and to speak with Rotary for three major reasons. First is that I believe that I share the same vision and the same engagement relation to world fraternity with the Rotary Club. The second one is, I don't think if it was not for the Rotary Clubs, I personally wouldn't be here today, and I wouldn't be doing what I'm doing now. And this is for two reasons. The first reason is the most expensive part of my education when I got the chance to study in France, especially when I went to private school in high school, all of that was paid by my uncle, who was one of the prominent members of the Rotary clubs in Senegal. And it's the spirit of Rotary, I think, that led him to decide to support me and my brother and my two sisters. And our current success, and I'm saying this with humility, is linked to him. I think he's the spirit of the Rotary Club. The second one is that if it was not for Rotary, I would not have met my wife. She had a Rotary scholarship and came to Senegal. She's from Poland. I was studying in the US, had a Rotary scholarship and came to Senegal. And that's how we met. So I'm always happy to come back here to come and talk to any Rotary clubs. So thanks again. And today my presentation, I know I have about 15 minutes, maybe 12 now, is based on three questions. One is, how did the world talk about Africa? How did the world imagine the doomsday in Africa on the onset of the COVID-19 pandemic? The second question that I'll ask is, what really happened and how did Africa react during this pandemic time? And the third question is, how can we learn from Africa as we move forward? So why did the world imagine the doomsday in Africa? And what comes to my mind, I often like to think of the world from the perspective of my grandmother, who was a philosopher who never went to school. But today, I had to do this quickly. So I couldn't think of my grandmother's wise words to frame my talk. But as I asked this question, what came to my mind is an African proverb that says, until the lion tells the story, the hunter will always win. And there are two events that are extremely interesting and that brought an outcry, really, on the continent in general. One was the director of WHO, of the World Health Organization, Tedros Ghebreyesus. He's an African, and yet he declared during the first days in March, right? He declared, Africa must wake up, otherwise it will disappear. And that was a shock for us on the continent, not only because he said that, but because that was repeated all across the world. New York Times, RFI, major news outlets, BBC, CNN, they was repeating all the time, predicting that Africa was going to succumb to and disappear because of COVID-19. And we kept asking, but why? Why would we disappear? Why is it that when there is a problem, people turn to us and think of us as those who don't have the means to defend themselves or to solve issues? What does that make of our own humanity? What does it say? What is it that the world is saying about us when they make those type of declarations? And the second point that I wanted to make is, during the same time, there was an interview with the French president on RFI. RFI is the major radio station in France. And one of the journalists asked, what can we do for African countries that lack of everything? No resuscitation beds. What can Europe do? What can France do? And the French president replied, we want to help absorb the shock and therefore mobilize the other G20 powers to help build capacity and provide health systems. And then ultimately we'll provide them with what they need. And he talking to the journalist, he said, as you said, they need beds and respirators. So we have to be able to buy these materials for them. We are in the process of producing them. for us, for our own system, but I want us to be able to help them. So what I would like Africans to do is just to wait for us. And after we're done, after we solve our problems, we will help them so they can just wait. And again, the words of the director of the World Health Organization and those of the French president were met here on the continent with awe. You know, we met it with awe because it reminded us of the constant tradition of infantilizing Africans. While the world was burning and we were holding strong, we were still presented at those who needed help. Otherwise, they would be devastated. Like children, unable to take care of our own issues, the president of France was asking us to wait for him so that he could save us. And, I kept wondering, where does this arrogance come from? This self-satisfaction that is displayed in an insolent way that my grandmother would call the curious attitude. And these are the words of my grandmother. He would always say, some people have the curious attitude of someone who is in the middle of a burning hut, and yet who worries about the neighbor's burning cake. Indeed, this is particularly surprising because these words were pronounced when those who really needed help was not us. And this brings me to my second question. What really happened and how did Africa react? Let's compare very quickly the reactions of the West and that of most African countries to better understand how prepared some African countries were. France, for example, land of the president who wanted to help us, closed its schools and confined its, locked down, confined its citizens on March 17th. They already had nearly 7,500 cases and 200 deaths. Italy confines its citizens 7 days earlier, March 10th, when they already had 9,000 cases and nearly 500 deaths. New York closed its schools on March 22nd, when they already had 34,000 cases. During the same time, most African countries closed their schools and imposed some types of lockdown before they even had 50 cases. And yet we were sleeping and had to wake up. Even more interestingly, in January 2020 already, before we had any cases on the continent, there was a conference that was organized in Dakar, Senegal, where I am right now, that brought together a third of African countries in order to prepare for the pandemic in a collective way. Before even we had a case, we had a plan to work together to prepare for the pandemic. We barely had any cases at that point. And it took the West months and hundreds of deaths before they started to talk seriously about cooperation. And still. So who should really advise who for once? How many of the major Western cultures can claim to have from the first outbreaks of the virus? And this is what happened in many African countries. In Senegal, for example, how many can claim to have isolated those who are ill, identified and quarantined all their contacts, and tested them at the end of their quarantine periods? Many African countries did exactly that. How come a different message is often given? For example, when I was positive at I tested positive at a certain point. When that happened here, not only did they come to my house to test me, to quarantine me, but they traced most people who were in touch with me, went to their houses and tested them. Within a couple of months of the onset of the COVID-19, in Senegal, for example, we created a test, sort of a version of the PCR test that costs about $1. So how come when we talk of Africa, we still imagine these people are those who just sit down and wait to be helped? In spite of everything, the French president and the director of WHO still managed to do that. Now that hurts because it participates in the constant representations of Africa as not adults, as not human, as not ready to take care of their own issues. Now I move to the third point, which is how and what can we learn from Africa as we move forward? I will start by saying that I do not believe in simplistic dichotomies. You know, there's Africa, there's the West. I don't believe that. But how can we learn from the experiences of some to better our world? I have noted, as I said before, that the effect of the caricature of Africa during this pandemic is negative for us, but it is also for the world. I also talked a little bit about ways in which we dealt with the pandemic. I will now talk about what can we learn from our experiences. Right now, as we're talking, there seems to be a general agreement that the solution to this question, the pandemic, is gonna be the vaccines. And there is sort of a general agreement that scientists that we trust will find this particular solution. And it is true. I agree that the COVID-19 will hopefully be defeated by science. We are focused, as in the US and everywhere in the world, in most places, on the vaccination of people. But are we thinking about the causes of the coronavirus, which is more likely of natural or animal origin through spillovers infection that has spread to humans via some wildlife host? Either that, or even if it comes from a lab, in one way or another, it is either linked to the way we treated animals, or it is linked to the greed that happened in a particular lab. One thing that we should remember, though, is that both are linked to the understanding that the human being is the master and possessor of nature, that we can deal with nature however we want. We are so central and so important that we can cut trees, we can kill animals, we can treat them in whatever way we want. And it is that imbalance that led us in a situation like this. We can find whatever vaccine we want, but if we don't solve the problem of our relation with nature, there will be another coronavirus or something similar that we will have to deal with in the future. But why is that important? And what does Africa have to do with this? Let's remember that in most African countries, the relation to the world is fundamentally environmental friendly. In most of our cultures, we understand life as a combination of our relations with everything that exists. In most of our cultures, we believe that there is a God that invented the world, but God didn't invent the world from nothing. They insufflated, they put in part of themselves in everything that exists. God breathes his life into things. So everything that exists is not only godly, but it's linked to us. So if we learn from those cultures, then we will have different relations, not only with each other, but also with animals, with the nature, and with the world that we live in. And that is that which will avoid the next coronavirus, rather than just finding the cure, which is nothing but stopping the symptoms, but not touching at the very core of the illness, and for this matter, the pandemic. And this is something that African cultures can teach us. The second thing that African cultures can teach all of us is humility. Because let's face it, the pandemic became this bad because we trusted ourselves and we believed that we're the center of the world so much that we thought that we could control it. I argue that in African countries, we know that we don't master anything. Because of that, we were careful from the onset. And it's also that humility, not only with each other, but with the world, with nature. I think that has saved many of us. Again, this is not a question of essence. Africans are not naturally a certain way, and European a certain way, Asian another way. We're all human beings. But we think that our histories and certain cultural particularities have led us this time, to be able to control the situation a little better than others. So this is also a call, and an African call, for celebration of our common humanities, but also for respect, because at the end of the day, we're also tired of being infantilized and presented as those who don't, those with whom the only relation we can have is help. Thank you.
Thank you, Doctor. Do we have questions? I might ask, have you seen ample vaccines coming in from around the world?
We have, I feel like, there's a lot of discourse that there's not enough vaccines here. That is true, but it depends on how you look at the situation. Less than 5% of the population are vaccinated. But then an important question is being asked as well. Do we need to be vaccinated in a place like Senegal, for example, when we have about 300 cases right now out of 15 million people? Are there other ways to engage to prevent and limit the possibilities of the spread of the pandemic? So I think what we should do again is ask the right questions and ask them differently. And even here, we are confused. Africans, we are confused because on the one hand, we are fundamentally Western, right? We have been within the Western world for over 400 or 500 years, but we're also fundamentally different. So there's this discourse, we should get vaccinated, we should get vaccinated. But there's also another discourse that say, why don't we do this differently? Why don't we engage differently with this pandemic rather than just focus on vaccination? Mm-hmm. And it's going down. Although most people aren't vaccinated, there's enough vaccines for those who want to get vaccinated. Although the world is saying, oh my God, they don't have enough vaccination. So the same discourse is coming back. They're not getting vaccinated, they're all gonna have it and they're all gonna die. The people are engaging differently. Mm-hmm.
Do we have other questions from the members? Well, thank you. Oh, Rob?
Thank you so much, Doctor, for your presentation. I love your suggestion that we notice the humility and how valuable that is. And I would love to know how you might suggest that be taught. We need it. I think we need humility very much in our society these days. And I struggle with wondering how we can be more humble. Any ideas or thoughts, very welcome.
Hi, Rob. My first reaction is, I really don't know. I wish I knew. I really, really wish I knew. But one thing is clear. it is that since the 16th, 17th century, the West has placed the subject, the individual subject, as the center of everything. On the one hand, there's so many good things that happen with that. The idea of freedom is foundational to that. Democracies were born from that. But the limits of that is thinking that the human being in general, but each subject is the most valuable thing that can ever exist. I think that the question is how, and that in itself is extremely arrogant. It is as if some of the foundation of the way in which we understand us as human beings is based on that arrogance. Two, one of the things that happened also during that same time, and those are the moments that invented the West, right, in general, is the understanding that the way we understand the world is the way everybody should understand the world. Right after that is the idea of universalism that starts, right? And that's still the case, you know, when you see Western countries tell the world how to think, what to do and what not to do. Not just Western countries. We are the same in many ways because we have accepted on the continent also the values and the modes of the way the West defined the world. We have made it ours. And we are in a world when we think of the world and we think that's what life is in general. I think that if we don't change that, then it will be very difficult for us to move forward with humility, because that arrogance seems to be some of the foundation of who we are, you know. And I think that's what's interesting in places like Rotary, the Rotary Club, that really reminds us that really the subject is important, but what matters most is what we have in common as human beings. What matters most is possibilities of cultural understanding, right? But yeah, that's what I think. I think it's very hard to teach humility, but that's what we should. That's exactly where we should go, because humility also is that which will lead us to understand that we are not the solution, right? And we are part of the problem. Just look around the United States right now and all the issues that are happening around diversity and inclusion, in all the senses of the term, no matter how you see it. There's so much lack of humility in the discourses all across the board, you know, and so much arrogance all across the board that we need to engage with, you know, because humility comes with also tolerance, and here tolerating the others for making the mistakes that we don't catch ourselves making. Again, yeah, I'm getting too long, but that's just. I feel like there's something pervasive about our arrogance in the world in general.
I think you hit a very important note of truth there. Thank you so much. That was beautiful.
Thank you, Doctor, for attending our meeting. I think you've set a record for us for distance, and we appreciate that. And I hope you come back other times as well. And
thank you.
Have a great day. Yeah. Bye. Just a question. What time of day is it there?
It's 5 p.m. in the car.
5 p.m.
Yeah.
Good.
All right.
Thanks
you all, and thanks for giving me the opportunity to speak to the Rotary Club and to give back. Again, if it was not for the Rotary Club, I wouldn't be here. And for that, I am thankful.
Thank you. With that, have a great day. We'll talk again.